Good afternoon, and welcome to the Region 2 Individual and Community Preparedness webinar series. My name is Allison Albright. I'm the Regional Preparedness Liaison for FEMA Region 2, and I'm going to provide a few technical considerations before we begin. Today's proceedings are being recorded and captioned. The archived event will be available on the Region 2 website in the coming days. You should be hearing audio through your computer speakers, so please ensure that your computer volume is turned up and so you can hear the proceedings accordingly. In the top right corner, we ask if you'd like to receive news updates from Region 2, and if so, please enter your email address and we'll be sure to add you to the distribution list. We have a question and answer session at the after the presentation concludes. You'll see a Q&A pod in the lower right-hand corner. Please feel free to submit your questions about the subject matter there, and time permitting, we'll do our best to answer them. Finally, at the end of the presentation, we will be sharing a PDF version of the presentation and a file share pod. You can click on each file and download it using the download button. And with that, I'd like to turn it over to Debbie Costa, Preparedness Liaison with Region 2, to introduce our speaker and today's proceedings.
Good afternoon, everyone. Thank you so much for joining us. I'm Debbie Costa, the Preparedness Liaison on the New Jersey FEMA Integration Team. On behalf of our team working to strengthen preparedness across New York, New Jersey, Puerto Rico, and the Virgin Islands, I'm thrilled to welcome you to our monthly Preparedness and Resilience webinar series. As part of FEMA's 2018 to 2022 strategic plan, our goal one is to build a culture of preparedness. Our division is focused on helping people prepare for disasters, which includes delivering training and workshops to help individuals and families and communities be better prepared and ultimately build more resilient communities. As part of our goal to create a culture of preparedness, we're pleased to be hosting this webinar to learn how to help children cope during the stressful experience of COVID-19. This webinar will feature Yvonne Muzquiz, a mental health psychosocial support coordinator with the AmeriCares Hurricane Harvey relief program. Yvonne specializes in working with children, adolescents, and parents. She has worked in private practice, psychiatric facilities, school systems, and in community-based disaster relief settings. Since 2016, Ms. Muzquiz has worked as a clinician, case manager, and psychoeducational trainer, providing mental health and psychosocial support to migrant children, healthcare providers, first responders, teachers, and disaster response professionals. She is a Texas licensed professional counselor who has worked in the mental health field for 19 years. Welcome, Yvonne. I will turn it over to you.
Thank you, and thank you for that introduction. I'd like to begin by saying that it's pretty common for people to somehow feel overwhelmed when they hear about the coronavirus. So it's also understandable that children will feel frightened or overwhelmed as well. That is why I will be presenting information and strategies to help children understand and cope with the emergence of COVID-19. Whether you're a healthcare worker in a hospital or clinic setting assisting children, or a parent tending to your own child's needs, this training will be helpful. So before I get started, I would like to bring to light some issues pandemics may bring to children. This was a study that was done in China in 2013. This study investigated the psychosocial responses of children and their parents to pandemic disasters. It specifically measured traumatic stress responses in children. Data was collected from 398 parents. It was collected using surveys, focus groups, and personal interviews. The results of this disease containment measure, such as quarantine and isolation, can be traumatizing to a significant portion of children. Actually, 30% of the isolated and quarantined children met criteria for PTSD, which is post-traumatic stress disorder. These findings indicated that pandemic disasters may create a condition that children and their families find traumatic. And because pandemic disasters are so unique and do not include prolonged support and recovery, they require specific response strategies to ensure that behavioral health needs of children and families are met. So it's really important to prepare and plan to meet these needs of these children. You know, this pandemic is new to all of us. This has never happened. We are all learning and continuing to learn new ways and ideas on how to manage. Schools have never been closed this long. We have never been isolated from our friends or families for this length of time. So like I said before, hopefully this webinar will bring some new thoughts and ideas. Here's a list of objectives that I'm going to discuss. I'm going to list some factors that affect emotional reactions in emergency situations. I'm going to present the most common reactions children exhibit when facing an emergency situation. I'm going to talk about best practices on how to talk to your children about COVID-19. Describe some of the psychological impacts of quarantine. Offer some strategies to prevent and manage the emotional effects of being quarantined at home, and present some activities that can help children express their emotions and promote positive coping as well. So for this webinar, here's a little definition of an emergency. An emergency represents an unforeseen situation that requires special attention that needs to be resolved as soon as possible. It has the potential to physically and emotionally harm those who face it. Children especially need to know what to expect and how to prepare and stay safe during this time. Here are some factors that might affect children if they are being directly affected by the situation, previous traumatic or stressful events in their life, death of a family member, friend, or pet, and being separated from their caregiver. Now, of course, how a child reacts and common signs of emotional distress can vary depending on the child's age, how the child normally copes with the stress, and characteristics and experiences of the child. Also, their social and economic circumstances of the family should be taken into consideration, as well as the availability of resources for the family at the local level. So, not all children react the same way. Some children may have more intense and long-lasting reactions than others. Here are some more factors that affect the emotional reaction of children. The manner in which parents or caretakers, important figures, react to the situation, exposure to the media coverage, continuous stress due to changes in family routine or housing situations. I'm going to discuss that last bullet point a little further because some families at this time are still continuing to recover from other natural disasters. I think about Hurricane Harvey, which hit Texas about 2 years ago. I know that there are still some families that are displaced, still rebuilding their homes, and there's still neighborhoods and communities that are still being developed, as well as the hurricane that hit Puerto Rico and some earthquakes that they experienced earlier this year. So for some children, staying at home doesn't feel too safe. Also, the rise in domestic violence and child abuse have also increased since COVID-19. So I would just like you to, I'm just going to pose a question for thought here. Just something for you to think about. How many children do you know that don't have the proper housing or protection at this time? Just keep them in mind as we go along. Now we'd like to talk a little bit about how child perceives information that's given to them. So before talking to children, the adults should be well prepared and understand that the data to give accurate information. Children and adolescents will use the adult as a frame of reference to understand the world and the emergency. So, children will use an adult as a reference point in understanding their world and what's happening around them. What the adult tells them, how the adult says it, and how the adult projects himself emotionally will have an impact on the child. So it's so important that before having the conversation, adults should be in control of the information and in emotional control as well. Here are some best practices for talking to your children about COVID-19. Filter information from the media before talking to your children. There is so much news about the current COVID-19 outbreak that it can be overwhelming for parents and even frightened children. So it's recommended to fact-check the information online, gather this information, and then share it with your family. You should use developmentally appropriate language. And you can use words like pandemic and coronavirus. These are words that are used in the media, and children might hear them as well. For a little one, you might have to get on their level and maybe speak to them eye to eye. So sitting on the floor with them is a good suggestion. As long as you have that face-to-face and eye-to-eye contact with him. For an older child, like a teenager, you might sit and watch television with them to answer any questions that they may have. And allow time for questions. Don't just talk and lecture to your child. Be able to listen. The child may have some questions or emotions that they may need to express. Also, you might want to limit some news time and choose an hour of the day to listen to the news. The best time to listen is midday or early evening. You don't want to start your day to alarming news or go to bed with any negative thoughts on your mind. If you're the type of person that likes to get up and drink your coffee and listen to the news first thing in the morning, your child may see that, might join you, and listening to how many people have died today might be a little alarming for them or might trigger them in some way. So it's just best practice to choose a time to listen to the news and choose an hour to listen together. Other best practices is talking to your children about what they can do to protect themselves. Avoid contact with people who are sick. Wash hands thoroughly and frequently. Try not to touch your eyes, nose, or mouth, especially if you haven't washed your hands before. Clean and disinfect objects and surfaces that are often touched. These are great. These are good preventative measures. And this is also a good way to find out what your child knows. This is a time you can ask questions, right? You can sit back and maybe ask your child, well, tell me what you know about COVID. Or how do you contrast COVID? Maybe what you hear could surprise you. Now I'm going to talk a little bit about the psychological impact of being quarantined. During emergencies, children may present a range of emotional and behavioral reactions. These are some that they might exhibit. Fear, anxiety, and worry. Changes in sleep patterns and eating patterns. I'm going to talk about this for a little bit. Eating and sleeping are a natural, healthy part of functioning, right? When we're hungry, we eat, and when we're tired, we sleep. So when you notice that there are problems, you will see changes in these patterns. Children will have difficulty concentrating, making decisions, become easily angered. They can also look distracted, maybe a lot of daydreaming or looking out the window, or really not focused on the task at hand. Excessive attachment. Some children may be more attached than usual. This could be a sign of a child feeling insecure and needing reassurance. This can also be really annoying for parents because the child is not acting like themselves. Maybe they're clingy or crying or just having lots of questions at the moment. Something I would suggest is maybe scheduling time during the day, one-on-one with this child, letting them know that every day at 2 o'clock or whenever you choose, the parent and child are going to have time together. They can share a snack. They can take a walk around the neighborhood or backyard, have a, sit down and sit in their backyard for 15 minutes every single day. If you can choose to do this, do it for maybe 2 weeks, and you will see some of those behaviors diminish. The hard part is, of course, being consistent and choosing something that you can do with your child every single day. There are also impairments of pre-existing health conditions that might surface. And with teens, you usually see more alcohol or tobacco use. And these are negative coping reactions for teens. So it's best just to keep an eye out for any changes. Scheduling family time once a day is helpful, but not just for fun activities, but to also help the child express their feelings. This is a good time for you to kind of see and look how the child is responding or acting, and it kind of gives you a clue as to how they're going about their day. These are more immediate emotional impacts for children, just having a general fear of infection, being frustrated, bored, confused, crying, having nightmares, changes in mood, and stress, whether it's environmental or personal stress. Once again, depending on the type of personality and character of the child, they can have different psychological effects. Maybe a child who is more sensitive and often overwhelmed by change or seeing the emotional anguish of others. This type of child may cry more often, have sleep disturbances, and nightmares. On the other hand, you might have a child that has trouble accepting instructions and standards given to them, and they might respond in a negative way. This child might be more rebellious or display more frustration and anger. So you never know, and it's really hard to compare. So what about the long-term impact of this? Once again, I'm going to go back to that study that I talked about earlier, the one in 2013 in China, where post-traumatic stress disorder measures were 4 times higher in children who were quarantined versus those who were not. So lifestyle changes, psychological stress caused by confinement at home can further exacerbate the negative effects on children's physical and mental health. So it's so important to have strategies and resources that can help your children. And lucky for you, that is our next topic. Strategies to prevent the psychological impact of social isolation. I'm going to start off with some strategies for caregivers. Practice patience. Easier said than done, right? Adults must be patient, but at the same time, still firm and consistent with the rules. Take a breath. Take time for yourself, even if it's just 1 minute. You can go to the bathroom, go to the closet, take a step outside your house, and just breathe. Just notice how you're breathing and just slow it down. And if kids ask, well, what are you doing in the closet? Or what are you doing outside? You can also help them understand that you need a break. And maybe this would be a good model for them to show too. Give immediate comfort. We talked about that a little earlier, about tending to your child's needs right in that moment if they're in distress. Slowing your speech and lowering the volume of your speech is also helpful. When we slow down or lower our speech, the person receiving our message will tune into that and will reflect it. Allow time for the child to adjust to a new routine. This is adjustment time for everyone. It's best to just keep practicing a routine as much as possible. Children like it, it's predictable, and it helps them feel safe and structured. I used to work at a psychiatric facility with children and adolescents. And these kids were separated from their parents and had to sleep and live in this hospital for anywhere between a week to 2 weeks. But without fail, every morning, I would see them either after breakfast or when they got up, they would walk over to a whiteboard that we had in the middle of the unit, and it had the schedule of activity. And so they would go up to it and they'd see, oh, okay, today's Monday, it's 9 o'clock, we're going to start school. Or it's going to be Friday at 4 o'clock, we're going to eat pizza. And then we would have a list of activities for them for the weekend. And without fail, these kids would just come out of the rooms every single day until they got it down, until they learned the routine and felt and structured. So that's an idea, to just have a plan just for the day. It helps build structure and reassurance for children. And people at this time, they think or they tell me, oh, well, it's been 2 months since this all started. Kids should be adjusted by now. They should be behaving. And I'm like, well, not really. It takes about 3 to 6 months for a child to adjust. So give them some time. As adults, we can reason and adapt better than children. We're older. We have developed a lot different. They're children. They still have to catch up. So allow them this time. These are other ways to help children and adolescents feel safe. As a parent or a healthcare worker, you want the child to feel safe and help them regulate their body. So when you notice a child feeling anxious, you can ask a question. What can I do to help you feel safe right now? Listen to the response, then make a plan to use this resource to help the child feel safe in the future. A small child can ask for a stuffed animal, maybe a hug. A teenager could ask to be comforted or just to be present. Maybe they just want you to sit right next to them just for some time. There are other sensory resources like music, aroma, and warmth. These are other ways to help you feel secure. Music is helpful. You can listen to nature sounds. Those can be comforting. You can diffuse scents like lavender or floral. You can even bake some cookies or cakes in the home and have that aroma. You know, it makes everyone happy, and it might bring back some good memories and conversation about birthday parties or Christmas. A blanket is helpful as well. If you wrap a warm blanket around a child, they can feel the warmth against their skin and have them sit with that for just a bit. You can throw a blanket in the dryer, and in a couple of minutes, you will have a resource that can help children of all ages feel secure. Another way in helping children and adolescents feel safe is by helping them feel empowered. Because there are so many things that are out of control in this world, so many changes. It is good to allow the child to have some sense of control over some things in their life. Hygiene is one of them. Practicing good hygiene. The child is doing something good for themselves and for others. You can help them understand that when they wash their hands and bodies, they have some control. Another way is giving them choices in their daily routine. And these are just some examples that I thought of. Choosing what to wear. You might ask a 5-year-old what they want to wear today, and they might choose to be a princess or a pirate. A teenager might want to have pajama day all day. And that's okay. That is their choice. Give them at least one choice. They can choose what to eat for a snack. They can choose when to have a break from school. Now, a teenager may say something like, well, I'm choosing not to go to school today. That's not a good choice. But you can work with them and maybe say, well, maybe you can get out of school early today or take a longer lunch break. You know, allow them to have a choice to feel more in control. Because you have to remember, kids that were in junior high and high school, they would switch classes. And in between those classes, they would see their friends, they would connect with their teachers, maybe ask questions, and that was their little way to engage with their world. And so they lost that. So even having small breaks from their schoolwork to maybe connect with a friend or a teacher would be a good way for them to have some choice in their routine. Here are other strategies for children and adolescents. Staying connected with meaningful people. Children feel less overwhelmed when they see other people are going through the same thing that they are. And sometimes they want to talk about it. And we have so much technology right now, it's so easy to connect. I have an 11-year-old nephew that I connect with. He lives in Georgia. And he will call me once a week and ask me, what's going on in Texas? You know, are you all wearing masks over there? Can you leave your house? What's going on? And this is what I'm doing, and this is what we're doing. And so he's trying to connect and feel like maybe he's not the only person in the world or only family that's going through this. It's important to allow kids to tell their stories. You know, everyone is in the same house with the same people telling the same stories. So it's good to allow the child to connect with other family members or friends and tell their stories. Setting routines is helpful, and goals, and limiting news information like we talked about before. And I want to go back and say something about routine. There's no strict schedule is required, right? There should be a clear order of routine, a sequence rather than a schedule. So kids know that they have to wake up, they have to eat, they have to go to school, they're going to have playtime, but not necessarily as rigid as, okay, at 9:15 this has to end, or at 4 o'clock, this has to begin. Just allowing them to have a routine and be flexible. There's something else I wanted to point out, supporting the elderly. Having children call their grandparents or other aging family members or friends is good. This might help the child feel important and know that they are helping others to feel happy in this time of need. These are some activities for families. Cooking as a family, coming up with different recipes, maybe having a child take turns every day, and if the 5-year-old wants to make bologna sandwiches for dinner, everybody should be excited and allow him to do that. Let him be part of it. Families can sing and dance together. You can have like a karaoke night, maybe doing household chores together, using coloring books, and doing informational activities together. And right now, from what I know, there are comic books, coloring books, informational books about COVID-19, and that has been something that I've learned that you can share with families, with your own family, as part of getting together and seeing what they know. So now I'm going to move on to the impact of school closures on children and adolescents. Prolonged closure of educational services and mandatory staying in households can have a negative consequence on youth, mentally and physically. Evidence suggests that when children are out of school, like weekends, summers, holidays, they are physically less active, have much more screen time, watch a lot of television, maybe have irregular sleep patterns and less favorable diets. All of this results in an increase of a loss of cardiorespiratory, which has negative health effects, which are likely to be worsened when children are confined to their homes without outdoor activities. So it's important to have a balance and get children to get outdoors. I cannot stress that enough. It doesn't mean that you have to be outside for 2 or 3 hours running drills or doing any type of circuit training. It's just choose some backyard projects, like gardening or building a clubhouse, or, washing a car, something. But even asking your child what their interest would be, instead of you coming up with ideas, ask the child, what is your interest? What would you like to do? What are you interested in learning? And I say that because, once again, my 11-year-old nephew told his dad that he wanted to learn how to shoot a bow and arrow. Well, that is something that my brother has no clue of doing. But this was his idea. And my brother went along with it. He said, you know what? It's something new. It's an activity. We're outside. We're doing target practice. It's just fun. So it's amazing, once again, what you can learn from your child if you just ask. So before I go to the next slide, I just wanted to have another question for thought. What about the children who had a pre-existing mental health condition prior to COVID-19? Does a child come to mind for you? And how do you think they're coping in this present moment? So now I'm going to address the impact of school closures for children with mental health needs. These kids lack of access to resources that they had previously in school. So they might lack peer support, mental health support, and face-to-face services. And yes, of course, we all hear that there's help online and phone support, but this can present some challenges for this population. If it's difficult for some of us adults that have to talk to others via computer or phone, the child may not respond as well. Schools, it's like when the schools are closed, kids lose that anchor, and symptoms could relapse. So you might find children wanting to stay in their rooms more, refuse to shower, or even leave their bed. In a survey that was done in the UK with about 2,100 participants with a mental health illness up to the age of 25, 83% of them said that the pandemic had made their conditions worse. 26% said that they were unable to access mental health support. So once again, keep these students in mind, or keep these kids in mind and how you can help them. And I'm going to address some activities that can assist in working with kids to help them adjust to school closures. Design a school agenda to follow daily that includes the time to be devoted to school subjects. The number one suggestion is to be organized. Develop a structure so that kids can have continuity of activity. Of course, you want to make time for snacks and recess just like regular school time. And you want to include space for free time as well. Having more active and physical games is good. You want movement. Kids are kind of stuck. They're sitting down almost all day, so you want them to get up and get active and create that movement in their body. Arts and crafts activities promote creativity and allows them to create something unique to them. So just allow them to play and to draw. Also schedule 30 to 50 minutes of meaningful parent-child interaction like we had talked about previously. What's also helpful is maybe having children engage in the decoration of their own chart or schedule. It could be made out of construction paper or cardboard or even on their computer. They can post it on their door or in the kitchen for everyone to see. And just have them be creative and unique to them. Maybe if your child was in the band or loved music, maybe they can create something with musical notes or the sports thing. I saw this mom on television, and she took Polaroid pictures of her, I think he was 4 years old, and she took pictures of her son eating breakfast, brushing his teeth, reading in school, playtime with the dog, and she took pictures of him. And so every day she would have him make his own little schedule by these pictures. And it kept him entertained, and it kept him on task. So as a parent, too, yes, you can be creative. And for parents who have become teachers and cafeteria workers and principals during the span of the last couple of months, a schedule could also bring some order and less stress. So, children don't have to constantly be asking parents, what do I do next? What are we doing today? This is something that they can construct and themselves and learn how to be more responsible. So I'm going to bring you one last question for thought. Think about summer. What schedule of activities can you use to help the child transition? Just like the child transition from school to homeschool, they're going to transition from homeschool to probably no school this summer. So, once again, prepare for another adjustment and how you can help your child adjust. I'm just going to talk about this slide. I think it's really important when to get additional support for your child. Even as a healthcare worker, if you notice these symptoms in your patient or even hear parents talk about these issues, it's best to contact your local mental health authority for assistance. And same thing with parents. If you notice anything about your children, use your local mental health authority as a resource. So, when to get additional support? When your child threatens to hurt others or themselves? Do not respond to others. Show no emotional responses with little physical movement. Appear detached from surroundings or fail to engage emotionally. Continues to seem confused or disoriented, showing signs of a mental disability that was not evident prior to the incident. And hearing voices that are not real or seeing things, people, in ways that are not playful or joking. Of course, you want to see this for an extended period of time. So be aware and just notice. I also want to bring a note of caution. To, be careful not to pressure children to talk about an outbreak or join in expressive activities if they don't want to. While most children will easily talk about the outbreak, some may become frightened. Some may even feel more anxious and stressed out if they talk about it, or maybe if they hear other people talking about it, or even look at artwork or pictures related to the outbreak. And the media is great about putting pictures of that little coronavirus circling around, and for some people that might trigger something. So I can't stress enough, if a child does not want to talk about it, don't force them. Allow the child to remove themselves from these activities or these conversations, and just monitor them for signs of distress. So in closing, just some important information to remember. Children need to know what to expect and how they can cooperate to prepare and stay safe during this emergency. Their emotional reactions are influenced by previous experience and the reactions that adults exhibit. It's also important for a child to feel a sense of safety. When talking with children about COVID-19, the adult should be calm. Give space for you to ask questions, as well as to express their feelings. And when dealing with the children's emotions, let them know that they are expected reactions within the conditions of which they are living. Encourage suggested activities to help children and adolescents express their emotions and promote positive coping. And I'd just like to end with this picture. I think it's so great. A little example of isolation. This picture was taken in Italy. Christina and her children and their neighbors worked together to create a rainbow of clothes outside their window. Creating rainbows in different forms can be a great way to encourage kids to think positively. And we all need some color in our lives. So please take a moment today to bring a little joy to someone special. Thank you so much.
Thank you. That was a lot of really very informative information and a lot of good tips.
Thank you.
Do you want to say anything about your resources before we go to our Q&A?
I just have a couple of resources, but I don't know if everyone can see them too well. But they will be on the PDF, correct?
Yeah.
Yes. So I won't go through that list. I'll just make myself open for questions if anyone has them.
Yes, I have some questions for you that people have written in. Should a parent tell their children about feeling scared?
I think it's important for parents to be honest with their child about their feelings, but not to go overboard with uncontrolled emotions or adult content, like you don't want to talk about your finances with your child if you're unemployed or any relationship problems that you're having. I think it is important for parents to say, you know what, yeah, this is a little scary. I am a little worried, but not to go overboard. Parents should address their own stress and anxiety in other ways, in healthy ways. And I think it's good to be an example, because if the parent expresses maybe a little bit of their fears or concerns, maybe the child will too, and know that, oh, everyone's human. We're all going through this. So I think it's okay.
Okay. What about if a child lost a loved one?
If a child lost someone, I would consider working with someone who knows how to support children who are grieving. I want to say there might be some in my resources, but as a parent, you don't feel like you have to take all this on your own. I mean, you can comfort the child. The parents themselves might be grieving as well, so that's okay. But don't feel like you have to resolve everything for this child, and just consider working with somebody who specializes maybe with grieving and loss.
Okay. What are the titles and books of the books and the coloring books? Is that information in your resources?
Let me look really quick. Yes, right there. I think it's books to help explain. Yes, it's an activity book. And I think there's one other. Those are sites you can go to.
Okay, but they're in the resources, so they're part of the PDF that we'll be adding shortly. Can a toddler understand the emergency and what's happening around them?
That is interesting, because so many times people will tell me, like, oh, you know, kids really don't understand, or a 2-year-old really doesn't understand what's happening. I actually have a 3-year-old nephew, and I think about that. But, you know, they really can't understand in words that something bad is happening, but they know when their caregiver is upset, right? They may start to show the same emotions as their caregiver, if their caregiver is sad or grieving. Even in events of death, you know, kids will pick up on that. They might start to show the same emotions. They might start to act differently, crying for no reason, withdrawing from people, and may not even feel like playing with their toys. So even though they don't understand verbally, you know, they can feel that something is wrong and might feel their emotions in a different way.
What do you think the long-term effects will be on children in a year or longer from now?
In a year or longer?
Yeah.
It's hard to say, but in the work that I've done, you know, I have seen a lot of post-traumatic stress. And I believe it's not going to happen right away, but I would say in about 8-9 months to a year, it will probably surface.
Okay. How do you think...
And even the whole adjustment. You know, kids are out of school. What about when they go back into school? You know, there's a lot of talk of that right now, and some children are not prepared to go back. I mean, what I mean by it, being around other people, and I've listened and heard of, you know, what some steps might be, and some children might not be ready for that, and that might also affect them and create some stress that might later lead to post-traumatic stress. So it's just different levels, I think, of adjustment and traumatic stress for children.
I think some of that's true for adults as well.
Yes.
How can teachers best support parents?
Teachers. I think by having direct contact with them, and I'm talking about like nowadays via phone, Zoom, you know, there's so many ways to connect with the families at least once a week and provide support in what's happening. Even though the teacher might not have all the answers or resources for that family, I think just knowing that someone is out there that cares, someone is out there that cares about their child, and maybe use the teacher as a resource. And if I was a teacher, I'd probably gather as many resources as I can for different types of issues or problems. And I know, especially for children with special needs, that is they would be a huge resource. I know some parents and families that are already having those connections with their teachers and school districts and being a part of a, not so much a meeting, but conferences that teachers will have with a group of parents and looking for other parent support. So not only is that teacher connecting with that parent, but maybe connecting them with other parents that are possibly going through the same thing. And I know there's lots of different types of groups that are taking place that I know of in the school districts too. So as a teacher, I would be a big support. Be a big resource.
Right. You talked about activities and getting some outdoor time, which is kind of easy to do when you're in suburbia, but how many of these activities can be tailored for children who live in urban areas?
Yeah, that's true. I don't really think about.
Well, earlier today, I was on the phone with two of my coworkers, and I'm like, okay, I know you guys about one stuck in one city, one stuck in another city, so I'm going to go outside and take this call and just share a little of my green space with them. But what do you do with kids?
That is a good question. I'm actually going to write that down and find more information on that. I've seen and heard where people are turning their living rooms into circuit training for kids or hockey fields for kids. But when space is limited, I think you just really have to be creative. I really don't know, honestly. I'm going to write that down and look into that.
Okay, thank you.
I was in Texas.
All right.
That is good to know in bigger cities.
Yeah. We just have one or two more questions. A participant wrote in about the amount of schoolwork really affects parents now. How do they limit the amount of times that they reach out to their families? Is schoolwork that important right now, or is their mental health more important?
Well, I feel like I'm a mental health advocate, so I would say mental health. And because if your kid can't function, then they won't be able to do anything, right? Not schoolwork or anything else. So getting your kid aligned, putting them in a good space where they can function healthy, I think that is a priority. And honestly, I've been doing some work with schools, and that is a topic that has been brought up about teachers and counselors reaching out to families, and the kids are just not able to function right now. They can't take their tests. They can't focus. And they continue to go back to, okay, start with the basics, making your child feel safe. What can you do? Maybe because they don't feel safe in this moment, they're not able, their brain's not able to capture what is needed of them. And that's a whole other webinar on feeling on safety, feeling safe, and how your brain functions when you are experiencing trauma, which I think a lot of kids are. And so I think mental health is getting your kids being able to function properly is probably a priority.
Yvonne, I don't know if you noticed, but a lot of the participants have kind of made some suggestions for the last question about children in urban areas, everything from bringing plants indoors to make the space a little bit more green, going fishing, getting a ride, to maybe a wooded area. The parks are open. I know all of New York City has lots of green parks. There's also lots of people, so you may still have to practice social distancing. But there were some really good suggestions in the chat box.
Great. Well, I wrote them down, too. So I can include them. It is true. I think being outdoors, like I said, I can't stress that enough. It's just, you're in another world when you step outside your home. But like I said, some people don't have safe homes, and some people don't have that green space. So this is good to know.
Okay, what is the basic recommendation that parents can apply when transitioning back to going to school?
What do you mean, like after the summer's over and school starts back up again?
Well, I mean, if you think kids have been out of school since March, and they're not going back to school this year, so it's going to be a long time between March and September. So how do you kind of get kids, back to the old normal, or the new normal, whatever it may look like?
I would suggest preparing. Of course, even practicing a routine, right? Going to bed at a certain time, waking up at a certain time, maybe even driving by the school that they're going to attend, and this is where the bus might drop you off, or this is where I might pick you up, and just practicing that routine with them, whether they're little kids or older kids. Usually little ones might need more of that. Hopefully the schools will help and prepare students. Maybe you can meet your teacher beforehand, maybe see what your schedule might look like. But it's all about projecting that into the future, right? So we weren't sure about what homeschooling was going to look like for a lot of people, but everyone adapted, and it keeps modifying, keeps changing. So I think by the time school comes around again, I think people are already making modifications as to what are classrooms going to look like, Are we going to have sporting events or not? So the same thing goes with this. And allowing your child to ask questions, and I think I had a slide in there about helping your child feel safe, asking them what that means, and using that as a resource when they're not feeling so secure. But if it's all about routine and structure, like, oh, I haven't been to school since March and I don't feel like going back to school, well, I'm not sure. It's something to look more into. But from my knowledge, it's always good to have a plan and to practice the plan, whether it's a week before school starts or a month before, and just help them get into that mindset that this is going to happen, and how are we going to do that? And if we come across problems while we're practicing and doing this routine, well, then we're going to address them as they come, not when that first day of school happens, if that makes sense.
I think it's very good advice.
Yeah.
Okay, I think that's all the time for questions we have today. Thank you so very much. We really appreciate you sharing your expertise with us. As we are unable to go out and do workshops in person, where the screen just went blank, we do have a number of webinars coming up, since that seems to be the only way we get to talk to our Region 2 stakeholders. So next week we have 2 webinars. There were links on the screen. Hopefully they'll come back. Oh, good. So on the 27th, how to avoid COVID-19 cyber threats, we have somebody from the NJKIC, the New Jersey Cybersecurity and Communication Integration Cell, and she will cover best practices and recommendations to reduce victimization from these threats. On the 28th, Victoria from the SBA in Buffalo will be back to talk about all of their available programs. I know she was here last week, and she spoke strictly about the CARES Act, but SBA has so many other programs available for small businesses. In June, we'll be talking about pet preparedness and about the continuous improvement program, both in English and Spanish, so folks could learn a little bit more about the FEMA process of continuous improvement and hopefully use it to adapt to their own businesses. And this webinar and all the webinars that we hold are recorded, and they are archived on the link on your page, on your screen right now. If you go to that link and just scroll down a bit, there'll be a tab that says Individual Preparedness Webinars, and this webinar will be posted one day next week. So if you know people who could benefit from listening to this webinar, it would include all the questions and answers, all the live captioning. Then the link will be right there on the FEMA Region 2 site. So thank you for speaking, Yvonne. Thank you, everyone, for joining. Have a wonderful, safe, and happy Memorial Day.